The Karnataka state has about 6.25 to 6.45 population, crores of population. And we have got about 2,353 primary health care centers and the community health care centers, the taluk hospital and district. So this is the pattern of our health. And in each 10,000 population, we have got one A&M center. The problem we face in the primary health care is the awarenessing of the people. Because the intention of me and our government is not to build more hospital. Our intention is to build less hospital, and we should make a situation and create awareness on the program. So the preventive will be given more measures, and then curative. Curative will be the last step. After taking all the preventive measures, we don't know, again we may get due to something is there, but the percentage will be less. At that time, we should have a good facility in the primary care, where the patient or where the poorest of the poor, with the confidence he will enter the primary health center, and with peaceful of mind he will take the medicine and come out. That situation is our aim. So the major problem in our primary health center was the shortage of doctors. Now even still we don't have in 300 hospitals, we don't have the primary doctors. And more than 1,600 PG doctors are vacant. So already we have called for, given for appointment, told the KPSC to appoint within 6 months they'll appoint. The shortage is due to we are not appointed for 10 to 11 years. And we are not appointed 10 to 11 years. Every year 100 to 150 they retire and go. And every year we started building hospitals. We are from 10 to 30, 30 to 100, 100 to 250, 250 to 300 bed we started. But we never planned for the, before government, they never planned for the human manpower structure. Today we are facing the shortage of about 50% of the shortage of the total staff. Who are the ambassadors of our primary health care? It's the doctors and the staff who are working in the primary health care are the ambassadors of our health department. If they are good, automatically people will say health department is good. Even if I am good or the secretary is good or the top level doctors are good and the primary doctors doesn't work efficiently with sincerity and honesty and commitment, automatically our health department cannot get a good name. But still the people appreciate the health concern department of our state here. At that time the problem arises is, we give untied fund. Every primary health care, other than this all salary, medicine, everything, we give, now we are raised to 2.5 lakhs every year. That will be untied. He can use for repairing, cleaning, if any extra medicine is needed or any emergency, he shouldn't tell we don't have money. 2.5 lakhs will be given to one. And this term sum will be misused because what we send, some use it in a very good way. Some only account is there, I have spent for that, I have spent for everything is there. And when a patient comes and when needle is got over, he doesn't take from this money, he gives a cheat to the patient. Get that medicine, get this needle. This spoils our name outside. So this year we have decided, because the difficulty is the doctors so we can understand. So this time we decided the medicines will be supplied on the base of need or not on the base of budget. So we have told our Chief Minister we don't want any welfare schemes because Karnataka has got highest welfare schemes to the people. We have got a lot of schemes and we don't have people in the ground to give to the people. And we have asked 3 things. One is appointment of all the doctors and staff, such increase of the salary for the doctors and staff. Third is unlimited drugs for the patient. These things should be given, and once that is there, the major problem will be solved in a primary health care. Concerning the cleanliness of the primary health care also, which is very important. And for that I say the doctor's duty, staff duty is not only to see that one patient comes, they have to see the hospital also surround. They should think it is their own house. Concerning that, their commitment should be there. And for that also they can spend in this untied fund is there. And it is the motivation of the doctor to involve the public in that. So without the involvement of the local Gram Panchayat, Jilla Panchayat, Taluk Panchayat and the NGOs, there should be a very close contact between the public and the hospital. Now there is a lot of gap. There is a lot of gap between the doctor, our staff doctors and the public outside. So what happens? Public doesn't come to see what this fellow is doing. And the doctors doesn't go outside and seek what these people need. So there is a lot of gap. Any small untoward incident happens there, people take all the anger on this PSC and this doctor. So if the close connection is there between the doctors and this public, there is no problem at all. So we have decided that every taluk health officer, because we have got one taluk health officer, and he'll have maximum 15 to 12 PSCs. And in 1 month, he doesn't have any other work to see this PSC how it runs. So we are directed all PSC. 1 day per month, that THO should be full day in that village, on that PSC, full day. He has to see the patient. In the afternoon, he has to see that all the local representatives, the Taluk, Jilla Panchayat members and all NGOs and the public community and the hospital, he should arrange a meeting and think and discuss what the people needs, and he should know the problem of the doctors, and people should know what doctor is struggling. That then they'll get an opportunity to support. And we have decided that the BPL families who are now doesn't get facilities in our government hospital, until the government build a regional tertiary care hospitals in every places, they can take treatment in private hospital, Shri. For BPL, it's called Vajpayee Shri, where more than 9 diseases and 400 procedures, they will take a free cashless treatment. They have to pay 9 paisa. They can go, and 182 hospitals we have empaneled. They can go directly, take a treatment, and one facilitator will be there. The system is how one Arogya will empanel the hospitals whoever come if they have got facilities and doctors only. If there is no doctor, then they will be cancelled. There no empanel won't be there. And one Arogya Mitra facilitator will be kept in there, in a kiosk will be there in every hospital. If my relative is not well, I go and tell this Arogya Mitra, he has to send a free ambulance, 108. Once he comes, we should show to the doctor. There the doctor sees him, refers him, say what disease will enter in a computer. And in Bangalore section, our doctors see and they give the approval, and the operation will be done without free of cost to come out. That's only one BPL. Now we have got Rajiv Arogya for APL also, because lot of discussion was there. For APL concern, many people are there. When go to private hospital, they APL. They pay the bill and come out, they come BPL. This is our intention, is to all should be APL only. For APL also, they have brought this scheme. The government employees, they are the one who pay the taxes exactly, government employees. So when their relatives are admitted and they didn't get discharged, they either pay the gold, land, they keep, and they. So now our government has got Jyoti Sanjeevani, they will be treated free of cost.